here is the clavicle, and when you're looking at the clavicle, you want to look for the conoid tubercle. Conoid tubercle is right here. It is on the inferior aspect of the clavicle, and it is also on the acromial end. This is the acromial end, or the lateral end. There's the conoid tubercle, and then here is the sternal end, or the medial end. The acromial end is a little thinner, and the sternal end is a little thicker. Again, look for that conoid tubercle first, and you should have no problem figuring out the rest of the anatomy of the clavicle. Here is the scapula, and here's the spine of the scapula, and that is going to lead us up to the acromion. If we look anterior to the acromion, we can see the coracoid process, which is sometimes confused with the acromion. So make sure you can differentiate. This is the coracoid process. One way to differentiate is to look for the spine of the scapula right here, and if it leads to a process, that process is the acromion. We look over here. This indent in the top of the bone is the suprascapular notch. Over here is the superior angle. Here is the inferior angle. Here is the medial border. Here is the lateral border. Some students have a hard time differentiating these two, so what I want you to visualize is the spine over here, and then on the other side I want you to visualize the humerus over here. So the side closest to the spine is closer to midline, that's going to be your medial border, and then the side closest to the humerus is going to be your lateral border since it's away from midline. Right over here we can see the glenoid cavity or glenoid fossa. That's where the head of the humerus is going to articulate with the scapula. And then we have an area above the spine of the scapula, which is the supraspinous fossa, and an area below, which is the infraspinous fossa. We flip over to the anterior side. This whole area is the subscapular fossa. And here is another view of that coracoid process that's on the anterior portion.